Hi, my name is Phil Krause. I'm a physical therapist at HealthQuest, located on Baldwin and Walden in Lake Orion. One of my favorite joints to treat is the shoulder. We use it to get dishes off the top shelf and to reach behind our back, to get on a belt, and probably more importantly, to play catch with our kids, or in my case, my grandkids. So we need to keep that shoulder in good working order. Each year, almost 2 million people see their doctors for shoulder issues. It can be very disabling when you get pain with any movement of your shoulder, or it gets so tight and stiff that you can't even raise the arm overhead or behind the back to perform simple daily functional tasks. In many cases, patients will consult with their family physician or internal medicine doctor and get medications and a script for physical therapy. In patients where conservative management, such as physical therapy, is not successful, surgical options are discussed and performed with an orthopedic surgeon. Today, in our first session of the Health Series, we are going to discuss shoulder pain and some of the more common problems. Our goal is to educate you on exactly what causes the pain and how to manage it to avoid surgery. In our second session here at HealthQuest, we're going to be talking about stretching and strengthening of the shoulder to allow you to do the things you want to do. In the last part of our series, we're going to discuss surgical options if the strengthening and stretching isn't successful. What most people call the shoulder is really several joints that combine with tendons and muscles to allow a wide range of motion in the arm to perform all of your daily activities. Unfortunately, mobility has its price, and it may lead to problems with muscles and tendons or other soft tissues and bony structures in your shoulder. Today, we're going to keep it simple and discuss some of the most common shoulder injuries and conditions. We're going to talk about rotator cuff problems, including tears and something called impingements and tendinitis. Secondly, we're going to talk about dislocated shoulders and instability. And lastly, we're going to talk about frozen shoulders, which is really just a very stiff shoulder. You know, people have heard about the term rotator cuff, but very few really know what it is. People want to know how to strengthen the physique muscles, the biceps, the pecs, but very little people know about the key muscle in the shoulder, referred to as the rotator cuff. Okay, your shoulder is actually made up of 3 bones. The upper arm, called the humerus, if you look at it, it has what looks like to be a round circular endpoint called the head of the humerus. It attaches to a triangular shaped bone called the scapula. And then lastly, you can see there's a bone that comes across where your collar is located, and that is called the clavicle. In many cases, I think of that head of the humerus sitting actually on the flat surface of the scapula, almost like a golf ball on a tee. There are 4 parts to the cuff, and they form actually a covering around the bone, the humerus, around the head of the humerus. If you look at the picture on the left, a front view, you can see there's a muscle called the subscapularis. That is on the front part of the shoulder blade. If we look at it from the back view, you can see there's actually 3 parts of the cuff. The supraspinatus, which is the top part, the most commonly torn part of the cuff. And then on the bottom part, you'll see a muscle called the infraspinatus and the teres minor. Those 4 muscles make up the rotator cuff. There is a lubricating sac above the supraspinatus tendon, and in the picture, you can see it's outlined in blue. That is called your bursa. And many times you have heard the term shoulder bursitis. This is the tissue that they're referring to. It becomes easily inflamed, and when it becomes inflamed, usually the tendon underneath it is in the same condition, and that is referred to as tendinitis. When one or more of the cuff tendons is torn, the tendon no longer attaches to the head of the humerus. This is a big problem. Most tears occur in the top tendon, as I said earlier, called the supraspinatus. Initially, there's a slight fraying, and as it progresses, it can lead to a complete tear. There are partial tears, and there are full thickness tears. When you have a partial tear, you're going to see more pain-related symptoms when you move your arm. In a complete tear, you're going to notice that you're not going to be able to raise the arm overhead. A lot of times as attempting to raise the arm with a torn cuff, you'll see the patient will hike the shoulder. Most tears are related to wear and tear and can occur as we age. Other big contributing factors could be repetitive stress. Someone who works on the assembly line who is raising their arm up and down repetitively in the same motion over and over again, where it just wears out over time. And then lastly, you can see occasionally we will get bone spurs on the roof of the shoulder blade, the acromion, which means the point of the shoulder, and on the undersurface of that roof, and that can rub over that supraspinatus, the top part of the cuff, and with time, that tendon will wear out. And as I said, over time, this tendon gets weaker and weaker, and once it's partially torn, it tends to become a full thickness tear. Some of the risk factors, anybody over 40 years old can injure their arm with repetitive lifting and overuse. Most full thickness tears, usually you see those occur in younger adults, and sometimes they're more traumatic. In addition, many times you'll see athletes fall on their shoulder, and they might tear the rotator cuff in addition to separating the shoulder, where some of the ligaments that attach the collarbone to the shoulder blade become torn and will need either immobilization and rest, or worst case scenario, reconstruction of the shoulder to stabilize the AC joint. Most of the treatment around a rotator cuff usually involves controlling the pain and inflammation. This could be as simple as taking Advil over the counter, icing, and just allowing it to rest. Once it's rested and it seems to be getting better, then you can begin a non-painful movement and strengthening program. If pain and weakness continues after conservative management, in the worst case scenario, we will end up referring patients to orthopedic surgeons. Orthopedic surgeons, there are many of them are specialists, and they can perform various forms of surgery, including arthroscopic, to clean up the cuff, remove bone spurs, trim the partially torn cuff, and usually the patients will get better following surgical interventions. Okay, the next thing we wanted to talk about is something shoulder instability. The shoulder joint is the most mobile joint in the body. It can rotate up and down, forward and back, and this makes it really easy for that to dislocate. The more motion the joint has, the more tendency it has to slip off. Earlier I described the shoulder, the head of the humerus, as being like a golf ball on a tee. So imagine a golf ball sitting on a tee. The shoulder has a cartilaginous rim called the labrum, and this tends to hold the shoulder in place. But unfortunately, this rim can become damaged, and in many cases, some people are just very mobile and hyperelastic in general, and they can begin to experience what we call a shoulder subluxation. If you look at the slide on the right, you will see that the golf ball is not really sitting on the tee. It's in a downward position compared to the shoulder on the left. And in a person who has a shoulder subluxation, their shoulder is in constant pain, especially if they do repetitive activities over and over again. That shoulder, that golf ball on that tee, just has too much movement. And in those cases, we are looking at strengthening the rotator cuff, the key muscle in the shoulder, to keep that ball on the socket, or to keep that golf ball on the tee. So it's very, very important in any type of shoulder instability, especially the ones that are like the baby dislocations, the subluxation, to keep the muscle stronger. Now in a full dislocation, if you look at a full dislocation, that is when the humeral head has slipped completely out of the socket. If you look at the picture now, you will see it's labeled right, and you can see that humeral head is no longer attached to the shoulder joint. It has slipped forward and down. The golf ball has come off the tee. In this type of a situation, the patient or the athlete or anybody who this happens to, they will have to get that shoulder put back in place. In some cases, they have to go to the emergency room and they have to put under an anesthesia where they're asleep, and an orthopedic surgeon or ER doctor will put the shoulder back in place. What do they do from there? In most cases, if it's a young person, they're going to be put into a sling for 4 weeks and then allow it to heal up. After that, they will see a physical therapist and they will begin a strengthening program, again, very specific to the rotator cuff and the scapular muscles that are going to help hold that golf ball on the tee or that humeral head on the socket. Worst case scenario, if the shoulder keeps subluxing or keeps dislocating, they will have to see an orthopedic surgeon, and procedures can be done that will, in a sense, tighten up the shoulder. The opposite of instability is a stiff shoulder called adhesive capsulitis. When you have adhesive capsulitis, it is an inflammation and shortening of structures called the capsulolabral ligaments. In the shoulder, those ligaments are referred to as the capsule. Hence, if it's very, very stiff and tight, it's almost like somebody took adhesive tape and just wrapped it around your shoulder. It came up with the term adhesive capsulitis. The head of the humerus fits into a socket, and when you look at the slide on the left, you can see that the normal joint capsule or capsulolabral ligaments look normal in nature. There's no inflammation, there's no scarring of the tissue. If you look on the right, you can see that the shoulder has red lines and strips going across it, and there's thick bands that form in the shoulder that are called adhesions. What you will see in a patient with a frozen shoulder is they will not be able to raise that arm overhead, either actively or passively. When I see a patient with a frozen shoulder, I ask them to raise their arm. They can maybe raise their arm that high. When I try to raise the arm, it does not go much farther than that. That joint is technically frozen, hence the term frozen shoulder. Over time, the shoulder becomes very hard to move. All right? Some feel after a period of worsening symptoms in frozen shoulders, they tend to get better. Most commonly, frozen shoulders, they will occur usually between the ages of 40 and 60, women more than men. People with diabetes are more likely to develop a frozen shoulder, sometimes for no reason. All of a sudden, they just notice that their shoulder begins to get stiff, and sometimes it will happen to the right shoulder, and then it'll happen maybe a year or two later to the opposite shoulder. There are really 3 stages that a frozen shoulder goes through. The first part is called the freezing. It's technically pain and loss of motion. The patient knows that something's wrong, their shoulder hurts, and they have lost the ability to put their arm overhead or reach the arm behind the back. The next phase, pain gradually resolves, but it stays stiff. Usually that second stage lasts from 4 to 6 months. And then lastly is the thawing stage. This usually takes from 6 months to 2 years, where you slowly begin to get a range of motion and strength return to your shoulders. As I stated earlier, some of the common causes are diabetes, hypothyroidism, hyperthyroidism, Parkinson's disease. You see frozen shoulders in patients with Parkinson's disease. And lastly, those with cardiac disease. Those are some of the systemic problems that can cause a frozen shoulder. Another very important cause of shoulders is immobilization. Anybody that has to not move their arm, be it for rotator cuff surgery, be it for a fracture, be it for a dislocation, if those shoulders aren't moved after a certain period of time, they can definitely develop the frozen shoulder with loss of both active and passive range of movement. What are the symptoms of a frozen shoulder? Initially, it's like a dull ache over the top of the joint. It's located over the outer shoulder and sometimes radiates down the upper arm. Treatment for a shoulder in PT is orientated around gaining motion through hands-on physical therapy and stretching of the joint. the therapist will actually put you on a table and start moving your shoulder to regain the motion. We also perform specific manual techniques called mobilization, and that is we will move that head of the humerus, that golf ball, and try to stretch the capsule of the joint. Surgery for frozen shoulders in the past consisted of something called the manipulation under anesthesia, where the doctor would just take you into surgery and force that arm all the way back. Currently, orthopedic surgeons are performing a arthroscopic technique called a capsular release. And at the same time, after they release the capsule or let it loosen up, they will manipulate the shoulder. But to be honest with you, a lot of the doctors now are just saying, you know what? With time, this condition will resolve. So there's a hard decision to make there. Do you have the surgery and try to get it fixed? Or are you going to give it a long period of time and gradually regain the motion? And as I said, a lot of the thoughts now are just give it time, it will tend to thaw out or become less frozen, and the results are similar to what you would get from a surgical procedure that is performed right away. Today we have discussed some of the more common shoulder problems and hopefully improved your knowledge on what exactly is causing the pain. In our next series here at HealthQuest, we're going to address shoulder strengthening and conditioning and what you can do to improve if you have any of the issues that I discussed today. If you currently have a shoulder problem, pain, or weakness, remember at HealthQuest we are performing free pain assessments where you can come to the clinic and be evaluated by a physical therapist. If it's not a complex problem, we can show you exercises and strengthening that you can do on your own. If it's more involved, we have many orthopedic surgeons in the area that we work very closely with who we could refer you to, and you could get a script for physical therapy. Thanks again for watching our first session of the health series on shoulder injuries. At HealthQuest, our mission statement is helping people live life well. I hope you have learned more about your shoulder and hope to see you soon for our next series on strengthening and stretching of the shoulder. See you soon, and thanks for your time.